The Ugandan Academy is a joint initiative between Janssen, the pharmaceutical companies of Johnson & Johnson, the Ugandan Ministry of Health, the Infectious Diseases Institute in Uganda, and the Johnson & Johnson Corporate Citizenship Trust to address unmet needs in HIV and TB, to improve health outcomes through innovations in clinical care, capacity building, systems strengthening, and research, which inform policy and practice with a strong emphasis on HIV and TB in Uganda. To achieve this vision, in August 2016, the Academy advertised its first request for applications for projects based upon research, capacity building, and clinical management open to Ugandan organizations of any size. This short video takes a look at the impact of the range of different projects over the last 2 years. It features interviews from IDI staff, subgrantees, and the various project beneficiaries about their experiences, best practices, and lessons learned. 2,640 health workers accessed e-learning resources. 750 health workers received capacity building, 879 patients accessed health information and adherence support. 6 subgrantees were funded in 14 districts. 6,828 beneficiaries were reached through subgrantee projects. 97% of patients in longitudinal cohort achieved virological suppression. And 2,200 student health workers were provided with hands-on experiential training. Integrated Community-Based Initiatives, or ICOBI, developed an electronic and case-based surveillance system to improve HIV and TB reporting and management. The system is designed to build the capacity of district health staff to identify and report HIV/TB case-based events that are important for measuring incidence and prevalence and tracking of patients under care or treatment.
This project, when it was beginning, we were looking at specifically improving clinical outcomes for HIV and TB, and specifically for HIV, we were looking at viral load suppression and TB remission. For TB, we wanted to look at the proportions of patients who start treatment and either they are declared cured or they actually complete treatment.
The idea behind the project was that we develop an application that gets the details of patients for TB and HIV, know them, know their appointments from the health facilities, and remind them on their visits. When a visit is due, they get an SMS, and they attend, and when they miss, then they are reminded continuously until they come.
Piloted in Shema district in western Uganda, the system has since been rolled out to Rubirizi district. The HIV case-based surveillance has been integrated into the existing paper-based HMIS systems, and several health facilities have had their staff trained in key components of HIV/TB case-based surveillance.
In Shema, we trained 40 VHT members and 36 health workers across the 4 facilities. And in Rubirizi, we had 43 VHTs and I think about 20 health workers. We looked at people who were already in the system. People like VHTs, most of them were expert clients who were already getting care from these facilities.
Once the patient agrees, then you enter into the file, then you enter patient's details in the system. Then after, whenever the patient comes for refills, pick drugs, that's what I mean, then you also enter that visit in the phone.
Of course, we are now happy that people who are coming up to take up treatment when they are willing, and with the continuous health education, the people are now coming up willingly compared to before.
The eCBS system is an important mobile health innovation that will improve treatment programs and patient care and have an impact on clinical outcomes such as patient retention in care, viral suppression, and TB remission.
I have been in contact with the focal persons and the system administrator at ECOBI for updates. If we analyze my data and their data, we try to compare from their system and my Minister of Health system, because they have to merge. So we first compare, we see where is the gap. And when we find the gap, that's why you go to the field and look for that gap where it is.
Enhanced HIV case-based surveillance enables the effective follow-up of cases and provides the data necessary for understanding local disease epidemiology.
Actually, I have learned that patients, for example, here at this health facility, very many patients have been missing because they don't have a reminder. But when this system came into existence, at least most of them have been able to turn up because they do get a reminder.
The fishing communities of Kalangala district reside in hard-to-reach areas that, as of 2017, had an HIV prevalence rate of 27%, which is higher than the national prevalence rate of just 7.2%. Sustainable Development Initiatives, SDI's mandate was to increase the community awareness on prevention, treatment, and mitigation of TB and HIV for most at-risk populations.
SDI, it's a CBO that we have been with some good time that has been helping us to offer services to the community. It has been helping us in referrals, let's say linking to the community, like we have a linkage facilitator around who helps us to go find out clients who are lost to follow-up, even get us samples from them, the sputum samples that we may need in contact tracing.
Kireeseewo enkyukakyuka ku balwadde ku bantu abalina akawuka abaali bava ku ddagala balizzeeko. Tubaali tufuirwa nnyo abantu ensangi zino nga bavudde ku ddagala. Ne SDI bwe yajja nempa omulimu gw'okuba nga nkola ku kyalo nga banoonyerezaako abantu abo abali bamira eddagala nga baalivaako, tandika okulibazaako, kimpadde essanyu lingi n'essuubi nti bonna bagenda kubeera balamu. Ekiruubirirwa kya SDI tukituuseeko nti abantu twabanoonya tubafuna era ne badda ku ddagala.
The project has helped SDI to move a step. We are equipped with the equipment in the office. We had a challenge of transport that connects from one learning site to another. So you could find that fishing communities could not access the timely health services. They helped us to get an boat ambulance that helped us to link the community to the facility.
We have a community which comes around without families. A mother comes in, walks into the facility, and he needs a referral for higher services, and he has no relatives around. Times SDI is contacted and fuel is provided.
Bwe njogera ku obstetric emergencies, in fact it is really an emergency. We call for help. Mr. Katumba akola kyonna ekisoboka okulaba nga abakyala abo basigala bali live n'abaana baabwe nga basevingiddwa.
Nali nfudde navaamu olubuto, nali nfudde nga ndi wano waggulu ku ddwaliro. ne bakubira n'omusawo Katumba n'ajja n'eryato n'ankima ne bantwala ku ddwaliro Kalangala nga simanyi gye ndi nga nafa nga simanyi gye ndi. Teyansaba yadde olw'ataano twatuukeyo twamalayo wiiki era bwe natereramuuko basawo era ne bamukubira essimu badokita bw'omulwadde atandise okutereera bujjangu okola ekyomulambule kati okundambula era ne bagamba mutwale awonye.
University ekiwagira n'Academy ekiwagira IDI ekiwagira olinda kigwa okuwagira
SDI facilitates the community's access to HIV and TB services at health facilities on Bufumira Island, where it is based, and surrounding islands. Bufumira Island is a 30-minute boat ride from the main island of Bugala. Outreaches sensitize and mobilize the communities on the islands and enroll patients into care, as well as share HIV prevention measures.
Naina mukwano gwange ennyo mwami Katumba musawo Katumba bwe tubeera nga tuli mu business nangamba nti naye nga nkulaba bulijjo muno naye wali weekebezaako ne mugamba mbadde sinaba kwekebezaako nangamba mbadde nyinayo wenjagala tugende bakukebere ku musaayi mukunkebera omusaayi nene singaananga ndi mulwadde oluvannyuma n'omukyala naye ne muleeta ne bamuggyako omusaayi naye ne bamusanga nga mulwadde n'atuyamba n'asobola okutukansolinga ne tulabika nti tutandika eddagala nga tetulina bwewaliikirivu bonna.
SDI enjigiriza nti ne bwemba bwendi nga ndi namwandu era nsobola okwekuuma kubanga sirina musajja naye tera nsobola okubeerawo nga sifunye kawuka nga wendi. SDI eyongedde okunfuula omukugu mu byenkola kubanga abantu buli wembeera nga ndi mu bantu awo mbayitamu mbakolamu emirimu omunengera okufuuka omukugu mu byenkola.
An initial 6 months capacity building phase saw SDI strengthen its organizational capacity in the areas of financial management, human resource management, monitoring and evaluation, and grants management. Additionally, with academy support, SDI is now equipped with a boat, engines, office space, furniture, and an internet connection.
Abakyala b'embuto bwe mutuuka ozzaala muzaalire mu malwaliro awali baddokita awali n'akawuka olwo bataasa omwana ate era n'endabirira beeyongera ogikuwa kaabye maama zinga ku nkyawo.
Many of the people in Hoima District's Kaboya sub-county live in hard-to-reach areas. Their uptake of HIV/TB services is poor, and the people affected lack information on these conditions. Hoima Caritas Development Organization set out to increase uptake of HIV/TB services, including diagnosis, treatment, care, and adherence in the targeted populations in Kaboya.
And we have basically 3 objectives. In the first objective, we're looking at community awareness on HIV and AIDS. But also, we have another objective which looks at increased uptake of HIV services.
They do this through linking patients back to care, empowering the livelihoods of groups of people living with or affected by HIV and TB, and encouraging client-led refills to solve the issue of transportation to and from the Health Center 3 that is far from the community.
Okadeo is helping us in areas of HIV testing and treatment. They have been doing HCT outreaches. We have been able to reach out to some people tested for HIV and following up of clients. And when you look at our catchment area, is too big. Of the catchment population of 32,642. Which is too big, covering 3 parishes, and our patients walk long distance to come here. Somebody can start treatment, but on the way, one reason or the other, it stops taking. They have been able to follow them up. Then we have also done what we call paternal services. Paternal services is where we test somebody. If we test somebody and find that somebody is positive We ask them about their sexual partners. Then we follow them up and test them. They have been able to do that.
Those activities are all geared towards increasing uptake of HIV-related services. Then finally, we have an objective still, like we began the first year, of boosting the income of the households that we're working with. So we support them in areas of household hygiene and sanitation. Then we also go ahead and support them in the areas of village learning and savings associations. Then after that, we also come up with small IGs that can create income in their households.
This year, Hokadeo supported 80 households by giving them nutritional advice and seedlings.
bakaba zimpiri naguti zikomeye kenjira yagwazimuka ngene icyo ndasima Hokadeo ko kurya ibyo yabaguri turarya iki urareba bakatwegesa no kubamba ko binabiri nk'ibyo n'ubutandaro ibyo bitakombe kiri kunuya abamwe baje barambuza ngo ubutandaro muri mpo mubwire nka icyo ndasimira Hokadeo
nkurora ntungiremo okumanya no kwegesebwe by'obuyonjo n'ebyenye ndungi ebyo kumbesaho no kumanya ngo kuturatwazanaga abantu obutetinira nico nyakatungamo
bategesenge ndungi kubame kujya mu kihuro ebihuro bishatu oyine kujya wakadodo ine kujyaho akatoki nkako rundishi akatakuli nkako na fakedejo etaburaho.
The members of these households are part of savings groups and they benefit from client-led refills for ART.
Bakakoramo group y'abantu mukaga kiroka mu group yegere betanga wazo members omu yerwari arete bagitahire no kundi kwezi hatayo ndizo musaka nawezeyo amurore hairwari icyamanyisa umwaka gona ni guhagire umuntu agire hirwari mirundebiri yonka transport ni betasa yawe yo mumaka.
Their approach to getting refills means that members are able to save transportation costs to and from the health center to pick medication. The AIDS Support Organization runs a mentorship program which was designed on the basis of the fact that many graduates remain inadequately skilled in the rapidly changing and complex nature of HIV and TB clinical management.
Our key goal was to cover the gap between the formal medical training and the practice on the ground, to ensure that this health worker, even when they complete their pre-service training and they are posted to a rural, hard-to-reach area where they may not have access to an experienced physician to support them or an experienced clinician, they go with the basic hands-on clinical skills to be able to save our population that are suffering from HIV or get TB infection.
So it is very key in quality service delivery to have knowledge and to have skill so that we give quality services, and the overall aim of the project is to increase the competencies of student health workers in clinical management of HIV/AIDS and TB.
To enhance the competencies of students in the same, TASO took on the service to provide hands-on experiential learning. These mentees have been selected in different groups over the course of the year and have been trained for 2 weeks in clinical management of HIV and TB and placed at the 11 TASO Centers of Excellence for experiential learning. The mentees are oriented on the first day and are assigned to dedicated mentors.
I was using problem-based approach, where a challenge which is identified, we send the mentees to go and investigate more about the challenge and even suggest possible solutions, such that when they're coming to present the CMEs to staff, they have a challenge and suggested solutions, and staff now beef up the discussion with the practical experience they have.
So this team project has been exposing these medical trainees to the hands-on practice, and also things to do with community service, reaching out to these clients in the community. It is something which is completely new, which was completely new to them, because the nature of the training, as you know, it is based in health facilities. But these clients are staying in the society, in the communities.
The training helped me to know more infections that arise when somebody maybe is infected with HIV, and how to diagnose them in the lab setting. And it has helped me because I didn't know much apart from the testing, and I didn't know the other part of managing an HIV patient. I just knew how to run maybe a test, but I didn't know about management of HIV patients. Which drugs do you give them? When do you give them? For how long? I came to know about different antiretroviral drugs and how to use them, when to initiate them, and yes, as I said, their interactions with other drugs that may be given at a particular time.
Yeah, well, at a table we did in GeneXpert, that's to test for the TB, to know the resistance. Let's say if a person comes and probably they're resistant to the first line drug, you get to know that from the GeneXpert.
How to handle TASO clients medically, and then also how to prepare their minds, like psychologically, emotionally. The biggest thing we are trying to avoid is the stigma. When there is stigma, then there is no way we are going to ensure that the 90 strategy is going to be achieved. And there is no way we are going to practice on clients when they do not have any clue about HIV, AIDS, and TB.
Over the last 2 years, the different projects that were identified encompass the breadth and diversity of organizations working in the fight against HIV and TB in Uganda. The projects show both creative innovation and large-scale impact as per the Academy vision.
The Academy really is growing into an innovations hub for health, coming up with ideas and innovations that can be implemented to improve the systems within the healthcare world. As this first phase of funding is coming to an end, we are exploring opportunities to see how we can continue to work with them. And one of the things we have done with some of them is while writing grants, we include like their mobile applications within the grant so that we can explore and see how to work with them, because we believe that they have developed tools that are very relevant to the health world. IDI also has other programs within Uganda, like specifically in West Nile and Bunyoro regions, and we are exploring to see how we could also work to also add value to those programs.